This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Ilara. Today we're looking at a fascinating new study from the journal Clinical Oncology, published in 2026. The paper is titled Efficacy and Safety Outcomes of Stereotactic Radiotherapy with CyberKnife System in Brain Metastases Patients Treated with Immunotherapy or Targeted Therapy.
This is a timely topic, Ilara. As we all know in our clinical practice, brain metastases, or BMs, represent the most common intracranial tumors in adults with advanced solid cancers. They carry a heavy burden, significantly impacting both morbidity and mortality for our patients.
Exactly, Dr. Aris. And while the neurosurgical landscape has traditionally focused on resection or whole brain radiation, the emergence of systemic therapies has really changed the game. We are seeing much more frequent use of immunotherapy, or IT, and targeted therapy, or TT. These modalities have undeniably improved survival outcomes, but there's a catch.
Right. The catch is that while these systemic therapies are improving, the interaction of these modalities with our stereotactic tools, specifically stereotactic radiotherapy and radiosurgery, or SRS and SRT, remains poorly explored.
That is exactly what this study aims to address. The researchers focus specifically on the use of the CyberKnife system. For the residents listening, the CyberKnife is a key tool in our arsenal for delivering highly precise SRS-SRT. This study wanted to evaluate three major pillars: safety, local control, which they refer to as LC, and overall efficacy when combining this precision radiotherapy with IT or TT.
It's a crucial investigation. When we talk about local control in the context of brain metastases, we're looking at the ability of the CyberKnife to halt the progression of the specific lesions we are targeting. Given how aggressive these solid cancer BMs can be, LC is often a primary metric for our success in the radiation suite.
And we can't ignore the safety aspect. When you combine potent systemic drugs like immunotherapy with high-dose radiation, the concern for the neurosurgeon and the radiation oncologist is always, are we increasing the risk of adverse events? Is the synergy between IT-TT and the CyberKnife system safe for the brain parenchyma?
Precisely. The study highlights that because these systemic therapies have improved survival, we are seeing patients live longer, which means the long-term efficacy and safety of their intracranial treatments become even more paramount. We aren't just treating a terminal event anymore. We are managing a chronic phase of advanced cancer.
The interaction mentioned in the abstract is really the heart of the matter. We need to know if the IT or TT sensitizes the tumor to the radiation, perhaps improving that local control, or if it changes the toxicity profile.
For the medical students listening, it's important to note the specific focus on advanced solid cancers. These aren't primary brain tumors. These are metastases that have spread. The fact that the CyberKnife system, a form of SRS and SRT, is being evaluated alongside these newer systemic agents reflects the current shift toward multidisciplinary, personalized oncology.
To recap for our listeners, the study's objective was to fill that gap in our knowledge. They looked at brain metastasis patients who were already on these modern systemic regimens and then underwent CyberKnife treatment. They were looking for hard data on whether this combination is efficacious and, just as importantly, if it's safe.
It's about finding that sweet spot. If we can maintain high local control through the CyberKnife system while the patient is on immunotherapy or targeted therapy without increasing morbidity, we're looking at a significant win for patient quality of life.
Definitely. It's a study that really bridges the gap between the medical oncologist office and the neurosurgical radiation suite.
Well, that's all the time we have for this deep dive into the 2026 Clinical Oncology paper. It's clear that as systemic therapies evolve, our understanding of how they interact with stereotactic radiotherapy must evolve as well.
Thank you for joining us on the Neurosurgery Hub podcast. We'll see you in the next episode.
Until next time,